Hello, this is a video on how to calculate the rate for a nurse-driven insulin protocol. So remember, the nurse-driven insulin protocol is only for patients that are not in DKA. If the patient is in DKA, then it should be a provider-driven protocol for the insulin drip. Please check their labs, look at their anion gap, and as long as there is no gap, you can continue with the nurse-driven protocol. You're going to have your admitted patient, that's a boarder, and the hospitalist is going to place a insulin-driven nurse protocol order. So you're going to see that over here for it's a non-critical care patient. You can acknowledge the order and then go to the MAR. Once you're in the MAR, you're going to see the bolus from the bag as well as the rate for the infusion. So once you're in the MAR, you're going to open up, click on the white part of the MAR, and you're going to open up the large part of the instructions. So for the bolus dose, it's going to be the same as the initial rate. So we'll start by calculating the initial rate. So what you're going to do is you're going to come down here and you're going to follow the admin instructions, which we'll go through in detail. But you're going to divide the current blood sugar by 100 and then round to the nearest 0.5 units. As you can see, it's super important that you get a up-to-date glucose reading from the patient. So don't use a blood sugar that's like 3 hours old. In order to get to the nurse-driven protocol, you're going to come over here and click on the hyperlink that says Insulin Infusion Protocol Nurse-Driven. Once you click on that link, it'll bring you to the nurse-driven protocol for you to follow. Once you click on the hyperlink, it'll bring you to the infusion protocol, and it says specifically here the exclusion criteria are for patients that are in DKA. If they're in DKA, then you need to follow the DKA guidelines. Assuming your patient is not, this is the goal. It tells you how to calculate the initial rate and bolus rate, and then what to continually monitor. And then it gets down here for the calculations. So now we're going to go over an example of how to calculate the initial rate and subsequent rates from there. Okay, so you're going to take a deep breath. You've got this. You've got your patient, and you just took their blood sugar because you've already seen the insulin nurse-driven protocol order placed, and their sugar is 137, and the hospital still wants to go ahead with the insulin protocol. So you're going to take 137, you're going to divide it by 100, which is going to give you 1.37. And you're going to round up to 1.4, which then rounds up to 1.5. Because we're going to follow the admin instructions that says round to the nearest 0.5 units of the insulin infusion rate. So now you're going to start the drip at 1.5 units. And if you ever have any questions, you can always ask pharmacy. It is a dual sign-off, so you will need a second nurse to double check your math and ensure the rate is starting at the correct dosage. If you have to give a bolus, this is going to be the same bolus dose as it is the initial rate. So an hour later, you check on your patient, and now the sugar is 221. So you're going to follow the nurse-driven protocol, and you're going to see that the sugar is now 221. Because you're a good nurse, you double check their BMP, and you see that their gap is only 12. So you know that the patient is not in DKA, and it's okay to continue the nurse-driven protocol. So the previous sugar was 137, and now the current sugar is 221. We're going to follow the table below to figure out how we got the new rate of 2.5 units per hour. So again, it went from 137 to 221. So in order to calculate the new rate, we're going to first follow the instructions down over here. It says step 1, go to the current blood glucose level, and identify the column. So the current is 221, and so we're going to come over here to step 1, and we see we are in the greater than 200. Then we're going to go down and we're going to say there was an increase because it went from 137 to 221. So that means there was a blood glucose increase. So then we are then going to go to the instructions, and the instructions are we're going to increase the infusion by 2 delta. Okay? And you can just follow the steps. The steps tell you what the rate of change is based on the previous glucose, and then we move over to the instructions, and the instructions tell us we're going to infuse by 2 delta. So then we're going to go down to the bottom, step 3. Step 3 is right here. And the current rate was 1.5, which is less than 3. So that's how we know we're starting in this top line. The current rate was 1.5, so we're going to start here. Then we know for the instructions up here, we're going to increase the infusion by the 2 delta. So that number is 1. So now you're going to add 1.5 plus 1, which is the rate change, which will give you 2.5. So that's how we get the new rate of 2.5 units an hour. So then you go back to your MAR and you adjust the rate to 2.5 units an hour. And again, it's a dual sign-off, so you have another nurse sign-off. An hour later, you go and you check the patient's sugar, and now it's 179. So it was previously 221, and now it has dropped to 179. So you're going to do a little math, and the delta, which is the change, the difference between the blood glucose, is 42. So previously it was 121, and now it's 179. So there's a decrease, a delta of minus 42. And again, because you're a super great nurse, you notice the gap is still normal, so this patient is able to continue with this drip. So now to calculate the new rate, you're again going to follow the instructions. You're going to find the new sugar column, which is 179, so it's going to be this row right here. And then you're going to go down, and you know that there was a change, there was a decrease by 42 units. So that brings you down to this row right here. Because the blood glucose dropped by 42, so that's this one right here. And so now we're going to find how we change the rate. So we're going to go over to the instructions, which is this column right here. And now we're going to decrease the infusion by delta. So then we're going to go to step 3 over here. And since our current rate is 2.5, which again is less than 3, we're going to go back to this top line. And since we're changing it we're decreasing by the delta, we're going to stop in this column. And now we're going to decrease the rate to 2, because we're going to take the 2.5, which is the current rate, minus the delta, which is what this is telling us, 0.5 units, now gives us 2 units an hour. So now you're going to go to the MAR, and you're going to update the MAR to 2 units an hour. So you might ask, how did you know how to decrease in this one and increase in the other one? You're going to follow the instructions. So the instructions say decrease by delta. So that's why I'm going to go over here. This is my delta. So I'm decreasing by my delta, which was 0.5. Whereas in the previous case, we had to increase by 2 delta. So we come down here, we find our 2 delta. So we have to increase. That's why we add. Okay? Now, if your patient has a gap, then they no longer are able to participate in the nurse-driven insulin protocol, and it has to be switched to an MD-driven protocol per policy. So notify the pharmacist, notify the hospitalist that has to change. These are the admission guidelines. So if they're on an insulin drip, but there's no electrolyte abnormalities, and the infusion is stable, then they can go to the floor. If there's changes or an elevated blood sugar, then they'll go to the step-down or critical care accordingly. Please reach out with any questions. Happy to go over this in real time.